Hey guys, Dr. Andrew here from Chiro Wellness Centre, and welcome to this episode of the Chiro Couch. Now today I'm going to talk about pain. I'm going to keep it nice and simple because it's a big conversation, but in my profession we see so many people in all different types of pain. They react differently to it. They might ignore it, they might medicate it, they'll find all sorts of things on Amazon and eBay to try and relieve it. But most people prefer conservative treatment while other people go straight to drugs or surgery. So I thought I'd just give you some fun facts about it. Now, almost all tissues in the body have the potential to transmit pain through signals. We call these things nociceptors. Nociceptors are specialized sensory neurons that respond to harmful stimuli like temperature or extreme temperature, mechanical pressure, chemical irritants by sending messages to and forth the brain. This results in that sensation of brain. Just to give it like electricity signals, but the messages are going to go up and down from the body. Now, without these messages, you would put your hand on a hot stove and you would not feel the pain. You would leave the hand there and it would cause a significant injury. That's why pain is there for a reason, and we should not ignore it. While most tissues have nociceptors, not all parts of the body have the same sensitivity or density for these structures. Now, an example might be the tissues exposed to the environment, like the skin, for example. These have really high density nociceptors compared to maybe internal organs which have less sensitive or less densities. Now, the severity of pain also doesn't represent the problem as well. For example, a paper cut is quite painful, yet people have cancer and have no pain. So here are 5 fun facts about pain that might help you understand it better. The brain itself doesn't have pain fibers or nociceptors. The brain lacks these pain receptors, and this is why you can do brain surgeries without medication. People can be awake while they're doing it. Now, these structures around the brain, like the meninges or the blood vessels, these do have pain fibers, and when irritated, these structures, or if they're inflamed, they can transmit signals which make it feel like your brain is hurting. This is interpreted as a headache, but it's coming from somewhere else. These original signals are just a perception of something else. Pain perception varies widely, so you might find that some individuals can handle it. Now, it could be genetic factors, it could be previous experiences, it could be maybe cultural, or even your moods can affect the way that you react to pain. What might be excruciating for one person might be tolerable for another person. But it'll also be learned. For example, you can acquire it through conditioning. So, for example, long distance runners have a better ability to block out pain than what short distance runners do as well. Have you ever heard of phantom limb pain? Well, this occurs when an individual has lost a limb, but they still feel the pain of the absent body part. This is intriguing, and it highlights the complexity of the brain, but also raises questions about the brain's adaptability and plasticity in response to these sensory changes. There's a thing called the gate control theory as well. Now, what this is that your brain will prioritize certain sensory inputs over others. In essence, it closes the gate to other pain signals. And this is why activities such like as rubbing an area can provide temporary relief. The tactile stimulation reduces the pain signals. Think of it like your brain is like a computer, and it can only process so much information once. So when you increase the sensation of one thing, you decrease it from another thing. And the last one is if you're having medications or injectable anesthetics or pain implants to minimize your pain, it might provide temporary or permanent relief, but the jury's out as to whether that's the best approach, because those pain fibers are there for a reason. They stop you doing something. So if you have no pain receptors, you could be causing further damage. Now, of course, research suggests that conservative treatment is a much best approach for the first, and drugs and surgery is best as last. But like I said for you before, pain is there for a reason, and we shouldn't ignore it. It's often the last thing to come, and it's the first thing to leave. And this is why, as chiropractors, when looking at back problems, we always recommend you prevent problems from reoccurring in the future, rather than just treat them when it's too late. You see, maintenance is much better than cure. And about 95% of my cases I see with people with chronic cases, that is, could have been prevented if we had found it years before. No difference to getting your teeth checked regularly to prevent tooth decay. So when was your last chiropractic checkup? So I hope I gave you some information about pain, how you can look at it from a perspective, or whether you need to prevent it. But if you have pain, maybe you want to come and see if we can help you prevent it from coming back, come and give us a call. So my name is Dr. Andrew from Chiro Wellness Centre, and hopefully you followed that because I really rushed through it to make it short. I'll see you all next week on the Chiro Couch. Bye for now.